So now I want to move on to exercise. So there's the third thing we're going to talk about, and the last thing we're going to talk about. We talked about nutrition, and then we talked about sleep, and now we're going to talk about exercise. So we know that physical training can really help improve mood, cognition, and emotional resilience. So regular exercise and physical training can really help with our resilience and our emotional resilience. So it is so important. And again, unfortunately, this is one of the things that we end up sacrificing as healthcare providers, as medical students, as residents, as practicing physicians. We tend to sacrifice the exercise, and we don't have time for that. We're too tired for that. We just aren't interested in it. But again, this is a very important part of self-care, of resilience, and protection against burnout. So we have to understand that, recognize that, and try to make time for exercise and regular exercise and physical training to help our emotional resilience. So there's many benefits of regular physical activity. That includes helping control your weight, which can then combat the different health conditions and diseases that are related to weight gain and obesity. Physical activity can improve your mood. It can boost your energy. It can promote better sleep. And if you do it in groups, it can be fun and it can allow you to socialize. So there's many benefits of regular physical activity. And again, all these things can add to our resilience, and we have to try to do regular physical activity to maintain our resilience. Aerobic exercise can help reduce symptoms of anxiety and depression. So again, the more exercise we do and the more aerobic exercise we do, that can really help reduce these type of symptoms of anxiety and depression, and could be a form of stress relief and stress management, and that can help prevent us from burning out. So we have to keep that in mind. So as far as how much exercise, so it's recommended for healthy adults between ages of 18 and 64 to do at least 150 minutes to 300 minutes of a week of moderate intensity exercise and activity. Or you could do more vigorous intensity activity, but then you should limit it to 75 minutes to 150 minutes per week. So this is what's recommended about how much exercise or physical activity should be done on a weekly basis. So we should spread it out over the week. And this is what we should try to shoot for. Now, this is just a general recommendation for healthy adults in this age range, but you should always talk to your doctor, talk to your physician about your exercise regimen and your exercise program. And it should be individualized for you and your weight and your health conditions and other medical issues that you may have. So these numbers might be altered and modified with the consult of your own physician. So make sure you talk to your doctor before taking on an exercise program and physical activity program. But this is general recommendations that are out there to help guide how much activity we should all be trying to do then. And then here's an example of different types of activities, moderate intensity activities, and then vigorous intensity activities that you can use to kind of help you decide what you might want to do. But again, make sure you talk to your doctor about what's best for you, what's the best form for you, and the amount and the time for you based on your own medical condition. So talk to your doctor before you take on an exercise regimen. And again, I think it's important to try different forms of exercise. For some people, one type of exercise is going to be helpful and they're into it. And for someone else, that's not going to work for them. So there's different forms of exercise that were listed on that previous slide. There's others out there as well. So try different forms of exercise and see what helps with you and what really works for you, and individualize it for you. And then you should develop a set of well-defined goals for your physical exercise regimen, right? And then work toward those goals. And when you achieve those goals, reward yourself when you meet those goals. And gradually, you should intensify your regimen. So start off kind of slow, take it easy, consult your doctor, and work your way up and intensify your regimen over time. And then it's important to find a support system to help you maintain a regular exercise regimen. So find some friends or family members who will support you, or you can exercise with and do the physical activity with, because that will be a source of motivation and support as well. There's various apps that are out there as well that can help you with your physical activity program, so you can use those as well. And I think it's very important to, again, notice the positive feelings as you are developing your exercise program and your physical activity regimen. You're going to feel better and positive when it comes to your physical health and your emotional health. And you should notice that, and you should feel that, and recognize that, because that will give you more motivation to continue to exercise on a regular basis. So again, it's very important to make sure that we exercise as part of our self-care strategies to help develop resilience